Congratulations on choosing the revolutionary MigraCore Migraine Stopper. Just a few simple steps and you're on your way to either reducing your migraine symptoms or completely turning off your migraines, typically all within 15 minutes. As with all medical devices, a few cautions before you start. Do not use this device if you have an ear infection or any ear pain, a recently perforated eardrum, any foreign bodies in your ear, and that's including water, or any recent ear or head surgery. And if symptoms persist, please contact your healthcare practitioner. In the clinical trial, which lasted 18 months, there were no side effects found in using the Migraine Stopper. But of course, if you use the Migraine Stopper and feel dizziness, nausea, ear pain, tearing of the eyes, or any discomfort at all, discontinue use. If that's all clear, let's get started. It's best to practice using the Migraine Stopper the moment you receive it. Don't wait until you have a migraine. These are the parts of the Migraine Stopper. This is the earpiece, the migraine relief air valve, and the bulb. As soon as your migraine symptoms start, take out your MigraCore Migraine Stopper. Insert the Migraine Stopper earpiece into your ear on the side that has the most symptoms. If you're not sure which side your symptoms are on, that's okay. Just start on your right ear. With your finger, push and continually hold in the migraine relief air valve. This ensures the correct airflow for the best symptom relief. Whenever you are using the Migraine Stopper, you must always continually hold in the migraine relief air valve. Make sure the earpiece is deep in the ear canal to ensure a snug and airtight fit. Remember, there's no need to push hard and there should never be any pain. Now gently squeeze and release the bulb. Start gently, as this is a new sensation in your ear. And feel for the pushing and suction sensation in your ear. When done correctly, there is a definite pushing and suction sensation. It's really important to feel the suction part in the ear. Suction means there is an airtight seal. Another trick to ensure an airtight seal has been achieved is to notice the bulb. When there is a good airtight seal, the bulb will return to its normal shape slowly. When the seal is not appropriate, the bulb will quickly return to its normal position. Once you have an airtight seal, you are ready to start. Now, gently pump the bulb 30 times for one cycle. One pump means both a squeeze and a release. Each pump takes about 1 to 2 seconds. Now remove the Migraine Stopper from your ear. Wait a few seconds to see if your migraine symptoms are improving. If symptoms are improving, put the Migraine Stopper back into your ear and repeat the cycle of 30 pumps. Keep doing these cycles as long as your migraine symptoms continue to improve or until your migraine is completely gone. If your migraine is completely gone at this stage, congratulations, you have just stopped your migraine and that is the end of your therapy. If, however, after treating one ear for several cycles, your migraine has not completely gone away, you then treat your other ear. Make a good seal in your ear and do a new cycle of 30 pumps. As before, take out the Migraine Stopper and see if there is further improvement. If there is, just keep repeating the 30 pump cycles until the migraine symptoms stop improving or the migraine is completely gone. The number of cycles for relief varies, but typically migraine sufferers need to repeat the cycles in their first ear 4 to 10 times and their second ear 1 to 6 times. But do as many as you need until the symptoms reach their maximum improvement or your migraine completely disappears. It's always best to do another cycle just in case the symptoms further improve or you do in fact turn off the migraine completely. The Migraine Stopper is incredibly easy to use, but let's be 100% clear about when to treat the first ear and when to treat the second ear. Some people will only need to treat one ear to turn off their migraines, but others will need to treat both ears. So, If you cannot turn your migraine off completely with the first ear, then and only then do you treat the second ear. To help, let me summarize a typical treatment pattern for you. As soon as you feel a migraine coming on, apply the 30 pump cycles. Remove the migraine stopper. If your symptoms improve, you repeat the cycles all in your first ear. Some people will keep getting symptom improvements with each cycle, and that will turn off their migraines. If that's you, congratulations, that's the end of your treatment and you have just turned off your own migraine. If, however, after treating the first ear a few times, you notice that further cycles are no longer improving your symptoms, then and only then do you treat your second ear. Treat your second ear in the same way. Apply the 30 pumps, remove the migraine stopper, and if symptoms continue to improve, you repeat the 30 pump cycles until your migraine is turned off. If your migraine turns off after treating your second ear, congratulations, that is the end of your treatment and you can go about your day migraine-free. If, however, after a few cycles on the second ear, you cannot completely turn off your migraine, that is also the end of your treatment. Of course, the goal is to always try to turn off your migraines, but if you get to your second ear and you cannot completely turn off your migraine, often at this stage, the symptoms are so reduced that you can function and go about your day. So, in summary, always treat the first ear to turn your migraine off. If you are certain you cannot turn off your migraines completely by treating the first ear, then you apply the therapy to your second ear. It's important to note that there are 3 stages of a migraine: the prodrome, the migraine itself, and the postdrome, which is also known as a migraine hangover. The migraine stopper can be used in all 3 stages. The prodrome is the first stage, when you know you are going to get a migraine. This is the best time to use the migraine stopper. As a general rule, the earlier you apply the therapy, the better. If you cannot get to your migraine stopper during the prodrome, for example, if you wake up in the middle of the night with a full migraine, still apply the migraine stopper and see if you can turn it off. Some people will be able to turn off their migraines at this stage, but others may not be able to when their migraine is in full swing. Postdrome occurs after the migraine has finished. Often it's the next day. The migraine sufferer can have hangover-like symptoms, feelings of tiredness, brain fog, low energy, or just not feeling right. Use the migraine stopper in this phase also. Just apply the same 30 pump cycles to one or both ears to turn the hangover-like symptoms off. If you always follow these instructions carefully, then congratulations, you have just treated your own migraine and taken back control. Use the migraine stopper as often as you need to either reduce your symptoms or turn off your migraines. No more missing out in life with the new Migracore Migraine Stopper.